5 warning signs of a stroke. You should never ignore. Imagine you're having a normal conversation with someone. Suddenly, one side of their face starts to droop. They try to speak, but their words don't make sense. Or maybe they suddenly lose their balance. These could be warning signs of a stroke. And when a stroke happens, every second matters. A stroke occurs when blood flow to part of the brain is blocked, or when a blood vessel in the brain bursts. Without enough blood and oxygen, brain cells can begin to die. That's why recognizing the warning signs quickly can make a huge difference. Here are 5 warning signs of stroke you should never ignore. Number 1. Sudden weakness or numbness. One of the most common warning signs is sudden weakness or numbness, especially on one side of the body. It may affect the face, arm, or leg. For example, a person may suddenly have difficulty lifting one arm, or one side of their face may begin to droop. Here's a simple test. Ask the person to raise both arms. If one arm drifts downward or they can't keep it raised, this could be a warning sign of stroke. Number 2. Sudden trouble. Speaking or understanding. A stroke can affect the parts of the brain responsible for language. Someone may suddenly start slurring their words. They may use strange or incorrect words, or they may have difficulty understanding what you're saying. Ask the person to repeat a simple sentence, something like, "The sky is blue today." If they can't repeat it correctly, or their speech suddenly sounds unusual, don't ignore it. Number 3. Sudden vision problems. A stroke can also affect vision. A person may suddenly experience blurred vision, double vision, or loss of vision. This can happen in one eye or both eyes. The important word here is suddenly. Vision problems that appear without warning can be a sign that something is affecting the brain's blood supply. Number 4. Sudden trouble walking or loss of balance. Another warning sign is suddenly becoming dizzy, losing coordination, or having difficulty walking. Someone who was walking normally a moment ago may suddenly stumble or feel as if they can't control their movements. They may also experience severe dizziness or loss of balance. These symptoms can sometimes be mistaken for fatigue or simply feeling lightheaded, but when they appear suddenly, especially together with other stroke symptoms, they should be taken seriously. Number 5. A sudden, severe headache. A sudden and extremely severe headache with no obvious cause can also be a warning sign. Some people describe this type of headache as appearing very quickly and feeling dramatically different from their usual headaches. It may also occur together with nausea, vomiting, dizziness, confusion, or other neurological symptoms. A sudden severe headache can have many causes, but it should never be ignored when stroke is a possibility. Remember, BEFAST. There's an easy way to remember some of the most important stroke warning signs. BEFAST. B is for balance, sudden loss of balance. E is for eyes, sudden vision changes. F is for face, does one side of the face droop? A is for arms, is one arm weak or numb? S is for speech, is speech slurred or strange? And T is for time. If you notice these symptoms, it's time to call emergency services immediately. Don't wait to see if the symptoms disappear. And don't try to drive yourself to the hospital. Even if the symptoms improve after a few minutes, medical evaluation is still important because temporary symptoms can sometimes be caused by a transient ischemic attack, or TIA. When it comes to stroke, time matters. Recognizing the warning signs and acting quickly could save a life and potentially reduce permanent brain damage. Share this information with someone you care about, because someday, knowing these 5 warning signs could make all the difference.